My next guest is Dr. Davis, Dr. Natalie Davis from the CMO of PreventScripts. Great to have you,
Hey
Natalie,
there, Logan. Thanks for
into the
having
Startup
me
Health
today.
Studio. It's such an honor for me to get to know so many inspiring health entrepreneurs. We're doing 54 interviews today, and I just feel like I'm learning so much about what's next in health and just getting inspired by people like you. So thanks for joining me. Tell me what PreventScripts is up to right now.
For PreventScripts, our moonshot is to partner with primary care providers to help them increase revenues by identifying their patients that are at risk for diabetes and hypertension, and we help them essentially intervene and help their patients reduce the risk of developing lifestyle diseases.
Okay. So, take me under the hood. Is it a platform? Is it an app? What are we talking about?
It's a platform. We're a tech-enabled behavior change platform, and we essentially have three components. The first component is risk assessments and surveys to help the doctors identify the patients that are at risk, and then to also assess the patient's motivation. Are they intrinsically motivated? Are they extrinsically motivated? And so it's a little bit of a clinical decision support for the physician to help them understand which pathway to put the patient through. And we have several pathways. The first pathway for the patients that are more extrinsically motivated, that's I do it because I should do it. Those patients go into an intensive behavior change modification program that is in clinic. The patients that are more intrinsically motivated can go into a little lighter touch program, which is a remote monitoring program in which the patient is able to self-track at home, and they use our platform to do that, iPhone, Android, with a tech-enabled behavior change piece of the scale connecting through to the physician. And then the third component of our platform is EHR integration, so that it integrates with the physician's day-to-day work.
How have primary care physicians responded to this kind of care?
Well, our partner this year and our progress from this year we can attribute to our partnership with Primary Care Medical Center, which is it's either a large, small practice or a small, large practice, depending on how you think of it, but it's a 20 provider practice in Murray, Kentucky. Now, this practice has objectively the best quality metrics of any primary care practice in the Commonwealth of Kentucky, and they have partnered recently with Village MD in their long-term transition to value. So we're excited to work with them. We have tested 1 of 6 of our prevention management bundle with them, and they're increasing their revenues, and so that is part of our...
Remind me how it increases revenues?
There is a bundle of codes that are 3 things: surveys, visits, and remote monitoring revenues.
You're making it easier for them to provide more care, there's more pathways that they're involved in, and then bill correctly for it. Is that correct?
That's correct. That's correct.
Awesome. What should we be looking forward to for 2020? What are you most excited about?
I'm most excited this year about behavior change. PreventScripts is about behavior change and implementing our 3 new features. We've got the Android iPhone platform. We're adding the remote monitoring features and the risk assessments. And then we're excited to guide these patients through this 6-month pathway. So we're about 6 months, 3 habits: drinking water, eating fruits and vegetables, walking 10,000 steps a day.
All important.
And those 3 behaviors create the 3 numbers which matter, which are your weight and your blood pressure and your blood sugar. 75% of healthcare costs can be eliminated by normalizing those things.
Isn't it amazing how we apply so much innovation necessarily to some such basic needs?
It's very,
I mean, I need to drink more water,
basic.
I need to walk more, and yet, we're trying to figure out how to use the tools at our disposal to solve these problems.
And providing patient behavior change can only happen when you change provider behavior.
Interesting.
That's what we learned this year.
Awesome.
What is hard about changing provider behavior? And when you're busy seeing 40, 50, 60 patients a day, it's very difficult to change what you're doing.
Interesting.
So
you're coming alongside and you're being that support to the primary care provider.
Right.
Which is awesome. All right, fantastic.
Thank you so much, Logan.
Wish you the best with 2020. Thanks for
Thank
stopping by
you.
the studio. All right, take care.